Hello. Today we're going to review the pharmacology and protocol update for AEMTs and paramedics here at Gold Cross. This update is intended to provide critical reminders about indications, contraindications, special considerations, and dosing of specific medications within the updated protocols. This is not an all-inclusive training and only highlights added medications, dosage changes, and routes of administration. All providers should always reference their protocols prior to administration of any medication. So let's begin. The medications that we will discuss in this training are ketamine, haloperidol, epinephrine, fentanyl, and tranexamic acid, or TXA. Let's first recall the 6 rights of medication administration. First, the right patient. While in the pre-hospital setting, knowing the patient we have is actually the patient that needs the medication is pretty irrelevant. In cases where it may involve patient-assisted medications, this would be relevant to ensure is the patient's medication. Next is right medication and indication. We will first ensure that the medication is appropriate for the patient's condition, presentation, and medical history. We must also look at the contraindications and/or drug interactions. Giving the wrong medication is the most common medication error, and we must do our due diligence to ensure we are correct in our actions. Next is the right dose. Nearly every medication is dependent on patient-specific factors like condition, weight, or age. The actual dosage needed is often not equal to the amount supplied in a vial or pre-filled syringe, and therefore, it is important to check and recheck the correct dosage before administering the medication. This is where it is beneficial to utilize the HandTevi app to verify the dose, and then having someone else, another medic or your partner, to verify the amount drawn up or to be given. Right route is medication and patient condition based. Some medications can be given by several routes, and you must consider which is the best route for the patient. Remember that medications given intramuscular or orally generally take longer to take effect. Also remember that any medication that can be given through an IV can also be given through an IO. Right time is the time that a certain amount of medication takes effect and may potentially interfere with other medications or additional doses. Last is right documentation. For continuity of care, it is vital that we document the time and dose that a medication is given. Often when turning over patient care, these specifics can be forgotten, and documenting these in the PCR will help ensure that those providing additional care are aware of the what, when, and how of our medication administration. Our first medication is ketamine, Kettler. This is a dissociative agent that causes sedative and hypnotic effects. Indications for ketamine are for severe pain, pain control, and mental health, behavioral, sedation. Contraindications for ketamine use are hypersensitivity or allergy to the medication or a blood pressure greater than 160/100. Adverse reactions that can occur are oversedation and hallucinations. With ketamine use, it is important to closely monitor the patient's airway as well as blood pressure. Dosing for pain control in an adult is 0.5 milligrams per kilogram intranasal, 0.3 milligrams per kilogram intramuscular. Max dose of 25 milligrams. 25 milligrams slow IV push, and the newest route is nebulized, given at 1 milligram per kilogram, max of 100 milligrams. To administer nebulized, mix with normal saline for a total of 5 milliliters by T-pipe. This will allow the patient to get the necessary amount of medication for pain control, and if they become drowsy, they will drop the nebulizer, discontinuing the medication. For pain control in pediatrics, the dose is 0.5 milligrams per kilogram, intranasal 0.3 milligrams per kilogram, intramuscular, and 0.25 milligrams per kilograms slow IV push. Max dose for any pediatric route is 25 milligrams. Dosing for adult sedation is 1 to 2 milligrams per kilogram, IV, and 2 to 4 milligrams per kilogram, intramuscular. Giving ketamine for sedation requires direct medical control order. This medication can only be administered by paramedics and is kept in the controlled substance box. Next is haloperidol, or Haldol as often called. Haloperidol is an antipsychotic medication that works by blocking dopamine receptors, dopamine 1 and dopamine 2, as well as causes depression of the reticular activating system and inhibits release of hypothalamic and hypophyseal hormones. Indications for haloperidol are acute psychosis or violent behavior. Haloperidol is used most commonly as a sedative medication for agitation and excited delirium. Contraindications for this medication are hypersensitivity and allergy to the medication. Special considerations include extrapyramidal symptoms such as dystonia, tardive dyskinesia, and Parkinson's symptoms. In some cases, larger doses of haloperidol can lead to prolonged QT intervals on an ECG. Cardiac monitoring is required for any patient receiving sedation, and as always, be sure to monitor the patient's airway closely. Dosing for adult sedation is 5 mg intramuscular, and this dose may be repeated after 20 minutes. Haloperidol can also be combined with 25 to 50 mg of IV or IM diphenhydramine. By administering both of these medications, this will improve the sedative effects. This is a paramedic-only medication. Epinephrine, adrenaline, isn't new to the protocol. However, with the latest scope of practice changes, AMTs in Georgia will be allowed to administer the 1 to 10,000 concentration of epinephrine in cardiac arrest. Epinephrine is a sympathetic agonist as a naturally occurring catecholamine that directly affects the alpha-1, beta-1, and beta-2 receptors. This causes vasoconstriction, leading to increased heart rate, increased blood pressure, increased contractility, and bronchodilation. Indications for use are cardiac arrest in a 1 to 10,000 concentration and asthma and anaphylaxis in a 1 to 1,000 concentration. Contraindications for epinephrine are hypersensitivity or allergy. Extreme tachycardia and hypertension should also be of concern when not a life-threatening presentation, such as cardiac arrest or anaphylaxis. Adverse reactions can include nausea, vomiting, palpitations, headaches, nervousness, or a jittery sensation. Again, in the absence of a life-threatening presentation, caution should be used with administering epinephrine to older adult patients or those with history of heart disease and coronary problems. Dosing for cardiac arrest in adults is 1 mg of epinephrine 1 to 10,000 given IV or IO every 3 to 5 minutes. In pediatric cardiac arrest, the dose is 0.01 mg per kilogram IV or IO. It is best to utilize the HandTevi app for all cardiac arrest calls, especially with pediatrics, as it will provide the appropriate calculated dose in milliliters based on age. Anaphylaxis dosage of 1 to 1,000 epinephrine for adults is 0.3 to 0.5 mg IM. Pediatrics, the dose is 0.15 mg IM. In hypotension and shock, the adult dose of epinephrine is 5 to 10 micrograms. This can be given as a push dose or as a drip. For push dose epinephrine, take 1 milliliter of 1 to 10,000 epinephrine with 9 milliliters of normal saline. Giving 0.5 milliliters of this mixture is the equivalent of 5 micrograms. Giving 1 milliliter of the mixture is the equivalent of 10 micrograms. For an epinephrine drip, take 1 milligram of 1 to 10,000 epinephrine and put into a 1-liter bag of normal saline. This yields a 1-to-1 ration or 1 microgram per ml. Epinephrine for hypotension and shock is limited to paramedics only. Fentanyl is an opiate agonist that is synthetic that acts as a central nervous system depressant, producing euphoria and analgesic effects. Fentanyl is used in the pre-hospital setting for pain management. Contraindications for fentanyl use are hypersensitivity or allergy to the medication, bradycardia, and hypotension. Adverse reactions are respiratory depression, drowsiness, hypotension, bradycardia, and nausea. Patients receiving pain management need to have their airway closely monitored and should also be on continuous ECG monitoring. Dosing for fentanyl in adults is 2 micrograms per kilogram IV or IM, with a max of 100 micrograms prior to online medical direction. In pediatrics under 5 years old, online medical direction is required for dosing. In pediatrics 5 or older, The dose is 1 microgram per kilogram IV or intranasal with a max dose of 50 micrograms given prior to contacting online medical direction. The intranasal or IN route is new to the protocol and should be the preferred method of administration in pediatrics. Also consider administering an antiemetic such as Zofran when administering fentanyl. Tranexamic acid or TXA, cyclocapron-listida, is a plasminogen inhibitor which is classed as a hemostatic agent and an antifibrinolytic agent. TXA inhibits the activation of plasminogen, reducing the conversion of plasminogen to plasmin, which breaks down fibrin clots, fibrinogen, and other plasma proteins. Indications for TXA are blunt or penetrating trauma less than 3 hours onset with hemodynamic compromise and bleeding. Contraindications are hypersensitivity or allergy to the medication, and mechanism of injury more than 3 hours prior to EMS contact. Severe head injury, subarachnoid hemorrhage, or thromboembolic disorder, such as pulmonary embolus and deep vein thrombosis. Adverse reactions include fatigue, headache, and dizziness. Special considerations include reduced dose for patients with renal insufficiency. Use in pregnant and breastfeeding women should be clearly indicated. Dosing TXA is 1 gram in 100 milliliters bag of normal saline infused over 10 minutes. TXA can be given by AEMTs and paramedics in Georgia.